What if I told you that the procedures that people want the most are also likely the ones where people have the most regret afterwards? Let's talk about it. Millions of people every year get plastic surgery or seek out plastic surgery for what is to be a life-changing transformation. But for some, and I would dare say many, plastic surgery disappointment is a real thing. And there are several factors that it has to do with. And usually it's actually not the surgeon. And so this is not about shaming anyone's choices. But let's talk about the 3 biggest procedures that are hugely popular, but also usually involve the most amount of regret afterwards. And I'll break down the crucial questions that you need to ask to make sure to limit your possibility of having similar disappointment. So first step is the unnatural facelift. Facelifts are great, and we've seen how they can work wonders on people. But everyone has the same goal usually, and that is to look refreshed, to look rejuvenated, to look rested, and to dial the clock back a few years, a decade or so. But there is a possibility of looking overly tight, where expression disappears and the face you see is not the one that you were born with. And even though people end up having great results that last a long time, that post-op disappointment and that post-op depression is very real. And it's especially real when the plan is just too aggressive. And by too aggressive, I mean too aggressive on the skin. When your main point of stretch is the skin and not the deeper tissues, then you do end up with that windswept look, that too tight look. So how do we avoid this? Well, as you know, the first step is always to find a board-certified surgeon. Especially in the face, this is not a place to start thinking about, I'm gonna go look up somebody who's not really trained to do plastic surgery so they could lift my face. No, that's definitely not the way. Here you wanna understand your surgeon's philosophy, right? And they have to talk to you about what they're doing. So when I talk to patients, I say to patients, so the point is not to make you look like you've been pulled tight, but rather to make you look younger and refreshed. And I do so by focusing on the deeper structures. So we have the mask layer, we have the deeper muscle layer, and if we pull those up pretty aggressively, then we can just gently redrape the skin so that you end up looking like you, but just a little bit younger, right? That's the conversation that you want to have. That's how you want that to go. You want to see befores and after, obviously, but also remember the befores and after, as we've talked about in previous videos, can be a little bit deceiving sometimes. If you don't go to a credible plastic surgeon, remember, because most plastic surgeons are actually posting credible befores and afters, it's the other set of people that are claiming to do cosmetic surgery work who are not, okay? And that may sound harsh, but let me relate to you something that millions of mothers have said, including my own mother. If you lie, you will steal. If you steal, you will kill. Okay, so let's just leave it there. And the key question that you need to keep in mind and that needs to be answered for you is, how do you keep me looking like me and not an alien? Number 2 is the good old nose job, a rhinoplasty. It is incredibly common, and especially now, and it is one where people have significant regret. Why? Well, there are a couple reasons. One, the nose is at the center of your face. It's the focal point for everything, right? People will see the nose no matter how you camouflage it. So it is huge in that way. 2 is, I think, especially now with social media and filters and turkey noses, and I don't mean the animal, I mean the country. We are seeing a lot of this very highly favored Eurocentric nose and everyone wanting to get to that idea. But the problem is, what is possible with AI is not necessarily possible with humans, unless you sacrifice breathing in a significant way, which is not usually popular. So when you have those kind of more unrealistic expectations walking in the door, and you have to deal with a year of healing with the nose, which means significant swelling, waxing and waning swelling, it can be really tough. So how do you avoid this? You have to be really, really honest with yourself before you ever walk into a plastic surgeon's office. What are your motivations? What are your expectations? And it is not a good idea to either filter yourself or find pictures of other people who are filtered to find the inspiration nose. The inspo nose is not going to exist realistically just by looking at a bunch of filtered photos. What you need to do is find pictures of people who have similar facial structure to you, have similar ethnicity to you, and find the idea within that bunch, because that will be what's realistic for you and actually what looks good on you. We need to get out of the Cindy Lou era of noses. Here is where I think doctor shopping is a great, great thing to do. I spoke to one person recently who said to me that she had gone to a few different doctors, and a couple of them showed her these AI generated befores and afters rather, and she just realized that the noses were way too small for her face, they were way too pointed, it was just very different from what she really, really wanted, and also for what realistically looked good on her. And so your doctor should be able to do the same thing for you, not necessarily give you the exact photo of what you will look like afterwards when they remove all the cartilage from your nose to achieve a Michael Jackson nose, but be able to describe to you what the procedure is and how it ends up being a realistic version of you and what is actually realistically achievable with your skin type, with your facial structure, facial anatomy, all of that. So 2 questions you want to ask here and want to make sure that are answered very well. What do you think is realistic from my face? What is a realistic goal from my face? What can I expect in that regard? And then second question is, how do you handle patients who are unsure about their goals? It's key to remember that rhinoplasty is not a surgery that will make these huge, bold changes, or it should not be, because realistically, we should not be deviating so much from where we are today to the point where we're almost unrecognizable, right? It really is a surgery where we're moving millimeters in order to create an enhanced appearance. So when you have that going in, when you have that notion going in and that idea going in, I think you will be more satisfied with the result afterwards. And remember, it really does take a full year to fully appreciate all the changes that have been made. Number 3 and the last, breast augmentation. Now let's be clear, most people are actually really satisfied with their breasts after an augmentation. I think there's been research to show that about 98% of patients actually are really satisfied and felt like their needs and expectations were met. But regret can still happen. The number one regret I often hear is I went too small. But other regrets can happen. Complications, expectations that were mismatched. Remember, your surgeon ultimately chooses your size because that's the person who's in control when determining the ultimate size, or choosing a size that's based on trends but not actual life. There was 80s hair, there was 90s boobs, right? Everyone had big giant boobs and maybe 2000s boobs as well. And as we've come to the 2020s, we're coming out of that. A lot of women want explantations, want to just look like kind of their small chested self. I myself have always said if there's one surgery that I would get, it's a breast reduction, because I feel like my cups runneth over a little bit too much. So how do you avoid regret here? The best idea is to think long term, right? It's not about how you feel in a bathing suit in 2027. It's about how you feel in a bathing suit, or how you will feel in a bathing suit in 2037. Thinking about what that long-term result could look like. If you go too big, gravity will take over, and the bigger they are, the harder they fall. So in 2037, you might not feel appealing with something that's frankly just big for your frame. And remember, breast implants are not for a lifetime. We recommend changing them out every 10 to 15 years. So if you get implants today, you will likely need another surgery in the future. So think about that. If you're going through an emotional time, or if your partner is super, super on board to the point of being questionable about you getting breast implants, please take a pause, because we take a pause when your husband comes and he's like, I really want double D's, throw some D's on that. It's not about him, it's about you. Now I want to hear from you. What's the number one question you think every patient should ask their plastic surgeon before going into surgery? Please leave your comments and your questions below. Hit like and subscribe while you're there. And as always, love you lots and bye for now.